Osteoporosis is very common. It's actually a disease that over half of Americans are going to have by the time they're 50 years old. 4 times more common in women than in men. And once you do have osteoporosis, you don't really know you have it until you suddenly have a fracture. What osteoporosis is an actual weakening of the bone over time. In the past, osteoporotic fractures of the spine, you just had to treat with braces and let someone just live with it until it heals. Because most of the time we know if we break our arm, it's going to heal over time. And what we usually do if you break your arm is you put it in a cast. Sometimes you do surgery, but you hold it in place to give it a chance to heal. We really didn't have a good way to put someone in a cast if they broke one of the bones in their back. Now we have some treatments for the fractures of the spine that are very minimally invasive as opposed to what was available even just a few years ago. So for many people now that have compression fractures due to osteoporosis, we can actually treat them by putting a cast inside the bone. If we get someone early enough when they've had the compression fracture where the vertebral body is actually being compressed down, often we're able to put via a very, very small incision this little tube and actually place that through the skin, through the bone, into the central part of the bone, and I can actually blow up that balloon and often improve and restore the height. And if I can do that, then they're hunched over a curve, they can actually be sitting upright a little better. And with that, then we can lock that in place by putting the bone cement in there. Once that bone cement hardens, it's like having that cast harden inside the bone, and many people can tell almost when they wake up that their pain can be significantly better. And this way, they can get up and start moving around. They're not laying around in bed anymore. They decrease the chance of having pneumonia because laying around they don't do anything that hurt too much. They don't want to take deep breaths. So this is one example of a very minimally invasive technique that can be done to help patients that have fracture due to osteoporosis.